I am Richard Tesefoli from Group 2. I'll be demonstrating first aid care for a patient or anyone who has a head injury. Okay, so head injuries are when your head is hit by a hard surface or an object, and there are two types of head injuries. We have the open and closed head injuries. So the closed head injuries are injuries that happen to the surface of the head, and they don't go deep and cause internal damage. But for open head injuries, they cause internal damage. There could be damage to the brain with excessive bleeding. So here I'll be demonstrating a patient who has a head injury on scene. So I'll be showing you how to perform first aid care on the patient. Okay. So first, we check the area for any signs of danger, see if the area is safe, and then we proceed to the patient. So prior to checking the patient, we asked any person around to call the emergency service. We wear protective PPEs if there's any. Then we go to the patient. We check the level of consciousness of the patient. Hello, sir. Hello, sir. As you can see, the patient is unconscious. So next, we proceed to check whether the patient is breathing and has a pulse. So you tilt the head. Okay, so there's breathing and there's abdominal movement. So the patient has breathing. And you check pulse over here. So pulse is also present. So next, we assume that since the patient is breathing and is unconscious, there may be a spinal cord injury. So we try as much as possible not to move the patient. Next is to check the site of injury. If there's any bleeding, you get a clean cloth and you apply to stop the bleeding, serve as a barrier. You remember not to put too much pressure on the wound in case you cause more complications. Then you wait for emergency services to arrive, and that will be first aid for head injury. Thank you.